Vanakkam, good morning. In this video, we are going to discuss about the fetal circulation. Fetal circulation is important during the intrauterine life. The fetus receives the oxygen from the placenta. So the placenta is act as the lung during the intrauterine life. So fetal circulation is the important short notes from the cardiovascular system. This diagram depicts a fetal circulation. Fetus receives the blood from the placenta through the umbilical vein. Some of the blood is passed through the liver and a major amount of the blood is passing through the ductus venosus. Ductus venosus enter into the inferior vena cava. Ductus venosus oxygenated blood is enter into the inferior vena cava. Some of the blood is enter via the superior vena cava into the right atrium. The 50% of the blood from the right atrium enter into the left atrium through the foramen ovale. You have to remember the word foramen ovale. Okay. So the remaining 50% of the blood from the right atrium enter into the right ventricle. From the right ventricle, it enter into the pulmonary artery. But lung having the high vascular resistance, high pulmonary vascular resistance, so it is in the collapsed state. So minimal amount of the blood is enter into the lung. So from the pulmonary trunk, the blood is enter into the aorta directly through the ductus arteriosus. So the blood is directly enter into the ductus arteriosus. So from the aorta, the blood is trained through the two umbilical artery. Umbilical artery carries the deoxygenated blood to the placenta. So umbilical vein carries the oxygenated blood. Umbilical artery carries the deoxygenated blood. Okay, so you have to remember. So the umbilical cord contains one umbilical vein, two umbilical artery. So ductus venosus carries the oxygenated blood from the placenta to the inferior vena cava. Foramen ovale transport the blood from the right atrium to the left atrium. Ductus arteriosus carries the blood from the pulmonary artery to the aorta. Immediately after the birth, the ductus venosus is closed. So after cutting the umbilical cord, the pulmonary vascular resistance is decreases. So it produces the expansion of the lung due to the stimulation of the respiratory center, and left atrial, due to the decreased pulmonary vascular resistance, the left atrium receives the more amount of the blood compared to the right atrium, and the left atrial reserve is raised. Foramen ovale also immediately closed in the interatrial septum, and ductus venosus is constricted immediately, closed within 1 or 2 days. So this also occur immediately after the birth, and left ventricular thickness is increases compared to the right ventricle. So before the birth, the thickness of the left ventricle and right ventricle is equal. After the birth, left ventricular thickness is more than right ventricle. The clinical importance after the birth, the foramen ovale is not closed, means it will produce the atrial septal defects. Due to the atrial septal defect, the left atrial reserve is more, so blood is moving from the left atrium to the right atrium. So it decreases the oxygenation of the tissue, oxygen supply to the tissue. Atrial septal defect is due to the defect in the closure of the foramen ovale. And the ductus arteriosus is not closed immediately after the birth, means it is produced the patent ductus arteriosus. So due to the high pressure of the aorta, the blood is moving from the aorta to the pulmonary artery. It is also produce the left to right sun. It is also decreases the oxygenation of the tissue. Summary of the fetal circulation. Fetus receives the oxygenated blood from the placenta via the umbilical vein. It enters into the inferior vena cava through the ductus venosus, and from the right atrium it enters into the left atrium through the foramen ovale, and remaining 50% of the blood is enter into the right atrium to the right ventricle. From the right ventricle it enter into the pulmonary artery. From the pulmonary artery it enter into the aorta through the ductus arteriosus. During the fetal life, lung having the high pulmonary vascular resistance, so it is in the collapsed state. So immediately after the birth, the ductus venosus closed, foramen ovale closed, ductus arteriosus also closed. If the persistence of the foramen ovale, it will produce the atrial septal defect. Persistence of the ductus arteriosus produces the patent ductus arteriosus. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.